and civil litigation. She's interested in government administration and consistency of legislation. While she's had limited experience in running class actions, she's seen the need, which hasn't been filled by other law firms who've chosen to remain silent during these times, to do something about what she sees as illegitimate use of legislative powers by the states and territories during these states of emergency powers. Welcome, Serene. Thank you so much for joining us tonight.
Thank you for having me. Wow, beautiful introduction.
Look, I'm so excited to have you here because I know some of the work you're doing is going to be, I believe, some of the most valuable work that we've seen in our history. And it's awesome that you've stepped up when so many won't. So let's kick right off tonight. We'll start off talking about the state of emergency in Victoria. Do you think, has the government acted in accordance with the law when declaring this state of emergency? And I wanted to know what conditions or situations, like the points that a government body would have, they'd have to tick these off, that would lead to having such a dramatic and desperate situation, the response that, well, basically closes everything down. So what gives a government the right to call a state of emergency?
Look, I think it's really important to understand what public health risk is and link it to state of emergency powers. So a state of emergency powers, when they can be declared as well, and by who? And who has the original, I guess, autonomy or decision-making in terms of national public health risks that would affect the whole country. It's important to understand the legislative framework under which this works as well. What's important to understand here is that Australia has a number of legislative frameworks. There is the Commonwealth or the federal framework of managing states of emergencies and public health risks, and that sits within the Biosecurity Act on the national level, and that's an act that came in 2015. That piece of legislation, I would say, is a good piece of legislation. It's been very well thought out in terms of how to roll out and when to declare a state of emergency. And I will come back to that in a short bit. The other layer that operates is the states and the territories' powers as well. And the federal legislator is not carving out the states and the territories from having a say in relation to public health issues. And those are usually captured in the respective public health acts and emergency acts that operate on under the jurisdiction of the relevant states and territories. Now, those acts, unfortunately, have come much earlier. Okay, so each of the states and territories have had acts, some of them in 1970s, 80s, 90s, 2000, early 2000s. And unfortunately, those acts, when you read them holistically, because they've had so many different amendments happen to them throughout the years, they can read almost in conflict with themselves. Okay, but what the Biosecurity Act did when it came in on the federal level, it actually created a precedent in itself. It means that all the states and territories, when it comes to public health risks and management, they have to work, they can't be inconsistent with the authority of the Biosecurity Act. What also the Biosecurity Act states is the following: that when agency, the health minister that sits on the federal level and the Governor General must declare the emergency and do a declaration order. Now, that declaration order is made under Section 475 of the Biosecurity Act. And the declaration order for the state of emergency creates a priority in the federal minister, okay, on the higher level. And the rules must be applied 100% with no conflict to the Biosecurity Act. Okay, now I'll explain when a state of emergency can occur. So what the Biosecurity Act says under sections 475 is that the Governor General may declare that a human biosecurity emergency exists if the health minister is satisfied that a listed human disease is posing a severe and immediate threat or is causing harm to human health on a nationally significant scale. They're actually very powerful words and very serious. On a nationally significant scale. And the declaration is necessary to prevent or control obviously the emergence of the listed human disease into the Australian territory and the emergence and the establishment of the spread of that disease. So you can see that the criteria is extremely high. And so the questions have to be is, well, when is a disease such that when can you classify it as posing a serious threat of harm, okay, and that is on a national significant scale? What the Biosecurity Act also says, you can't bring a risk to zero. So don't try to do that. That is not a realistic thing to do, okay? What is realistic is managing it so it's no longer a significant health risk. So on the 18th of March, it was determined, obviously, in response to the global issue for a novel coronavirus, that the uncertainties related to it would have probably necessitated, let's say, a declaration of an emergency. But we need to now assess 4 or 5 months on what has happened and what we have learned. And therefore that assessment has to come through with our learnings. And we need to ask, well, is it still a nationally significant risk? What do we know about this virus? Do we know how many people are asymptomatic? What are the percentages? What are the likely comorbidity? What is the likely risk of people dying with comorbidity of other diseases? What are the age groups? And what is the causal fatality rate? Now, what is the causal fatality rate? The causal fatality rate is actually an ascertainment of the percentage of those who die from diagnosed cases, okay? So we need to understand diagnosis, and we need to understand how things are being diagnosed as well. We need to look at testing. We need to look at controversies around that. We need to look at uncertainties around that and then determine that. Now, what has been determined, last time I checked, is the causal fatality rate in Australia is 1.38%. That's pretty close to zero, okay? So would a 1.38% causal fatality rate satisfy the terms of the legislation? Okay, this is a question. I'm not answering these questions. I'm just saying this is the process under which we need to start to turn our attention. And what is really important here is that how do these powers operate? Okay, how do they operate? What can the health minister do and what he can't? And what has happened here is that instead of the health minister doing appropriate requirements and setting them on the federal level so that the states and territories follows, they just outsourced it all to the states and the territories, okay? And the states and the territories are starting to act in a very ad hoc way against what the Biosecurity Act says, and in fact against some of what their own legislation says. And I will give an example. I will give a number of examples. What the Biosecurity Act says, you can set requirements that impact a group of people when it comes to the following aspects. And I will just get that. When it comes to, I'll get this, I've got so many notes here.
I can imagine.
So during a human biosecurity emergency period, this is section 477, the health minister may determine a requirement he or she is satisfied to prevent or control the entry of the disease, okay? And what it is, these requirements are limited to this. The requirements that apply to persons, goods, conveyances when entering or leaving a specified place, in regards to the movement of persons or goods, and the restriction in terms of that movement and evacuation. That means you can only give directions on a group of people only in relation to very general things like close of business, when to open, travel, export, import of goods, planes coming and going, ships leaving and coming, okay? You can do that on a group of people, issuing directives on a general thing. But the Biosecurity Act prevents from telling a group of people to do certain things, like masking, like isolating, like detaining, like vaccinating, like treatment, unless you issue an individual with the appropriate biosecurity control order. That means you can't just go to a group of people and tell them, all of you here, all of you, we don't care, we're not going to look at the details of each of your situation, you all got to be vaccinated, or all of you here got to wear some masks, all of you here have to be detained, and all of you here have to be isolated. No, no, no. That is a big no-no under the Biosecurity Act. What you must do is follow very strict processes that are set to ensure the preservation of human rights and to ensure that the only basis under which you can issue a biosecurity control order are the following. And this is section 60 of the Biosecurity the Biosecurity Act. So I will now talk to you about what a biosecurity control order, what it must consist of, okay? So, imposing a human biosecurity control order on an individual, that only can be done by a chief human biosecurity officer, a human biosecurity officer, or a biosecurity officer. Now, what do you have to do? A human biosecurity control order may be imposed on an individual only if the officer is satisfied of the following. The individual has one or more signs or symptoms of a listed human disease, or the individual has been exposed to a listed human disease, or another individual who has one or more signs of symptoms. That means you can't just go to anyone and say, hey, you have to be vaccinated, or you need to be isolated. You need to show that that individual is either themselves symptomatic of that disease, or you need to show the contact of who, the naming the person as to who they were contacted with who has the listed disease or the symptoms of the disease. And this is the criteria that is set under section 61 of the Biosecurity Act, meaning when you're issuing a Biosecurity Act, you need to tell the person the following. You need to tell them the ground under which you are actually ordering or imposing them to do something or not do something. You need to list the signs and the symptoms that they're suffering of the listed human disease. So unless you're actually symptomatic, they can't do anything to you, okay? Because this is all about prevention of risk. You have to show that you're an infectious risk or that you're a risk of infection. Okay, a perfectly healthy person who is not symptomatic, you can't just come and tell them to do something and tell them on a group level. Okay, you have to go to them individually. Then what you need to say, you need to give them a unique identifier. You need to tell them exactly who they were contacted with, the name of the person that also has the signs and the symptoms. That means you can't just say, oh, we think that you're exposed. We're suspicious that you might be. No, that's not how the law works, okay? You have to actually trace that individual and name them. And very importantly, you have to give them the right of review. You have to give them the right of reviewing that decision to issue you a biosecurity control order to either ask you to be masked, to be vaccinated, to be treated, to be isolated, to be detained, to be diagnosed, to be medically tested, everything, even the testing. If you want or require someone to do testing, you have to give them all of these requirements through a biosecurity control order. Now, some states and territories have reflected that in their respective public health acts, but they're not following it. Victoria has section 117, and it says you have to issue the person a public health order, and they're not following their laws. They're not following their laws and telling the people individually if they're a particular risk. You don't just go to a perfectly healthy person and then say to them, oh, as a group, I'm not even concerned about your personal details. All of you, just do that, okay? And you can't do that particularly in an emergency powers. Why? Because otherwise it'll go crazy. And I'm going to give an example how things have gone out of control and in fact created more of a virus risk. So what happened in the detention towers? Let's look at what happened in the detention towers and apply the Biosecurity Act to it, okay, versus how they handled the crisis in a way that is completely breaching their own laws and breaching the laws of the federal legislator. They identified originally about 23 to about 50 cases. I've tried to get the exact numbers, but I believe it was 23 who tested positive. Now, I'll come back to the problem with testing in just a little bit, okay?
Yep.
But assuming that these tests are reliable, for 1 minute, let's assume they are, but we'll come back to that later and we'll break that one apart as well, okay? But let's assume that these tests are positive, okay? You got 23 people who tested positive out of 3,000, or that you've located, not that you know that the rest are tested, but you know that you've tested and there's 23 here who are positive. If you genuinely believe that these people are symptomatic, now, by the way, a lot of them weren't symptomatic, okay? So they tested positive but weren't symptomatic. But let's assume they were, which they won't, but let's assume, okay? Let's assume you got 23 positive, you got reliable tests and 23 who are symptomatic. Do you then lock these people up with the other 3,000 people who potentially many of them can be healthy and lock them up in the one home confined in the small space and then bring to them 500 cops and then bring to them almost up to another 1,000 DHS staff in a very confined space where the whole notion is not to spread this virus, bring in people who are not trained, okay, and bring in and detain them without them actually being issued anything under the law to tell them that where they have to be, what risks they are, what rights of review they have. You've done nothing of that. And they've said, well, they can do that. It's an emergency. You can do whatever you want, apparently. It's an emergency. But let's see what happened here. What happened here is that the police and the DHS who are untrained started to leave biosecurity hazard waste everywhere. It was coming out of the bins. It wasn't wrapped and double binned, okay? It was willy-nilly. The food that was delivered, people were delivering it without gloves, some without masks, some were wearing the PPE suits, some were not. They were putting the food next to the rubbish bins. They were delivering food to people at 10 p.m. with leaking food that is not properly prepared by chefs who have occupational health and safety. So yes, we have processes for the purpose of us not going mad because we have processes under the law that create the right balance between human rights and the need to create proper safety checks. Okay, so the law, if it was applied, the Biosecurity Control Act and the Biosecurity Act and the Public Health and Mental Wellbeing Act in Victoria, truly holistically being applied, we would not be applying it in an ad hoc, crazy fashion where we're exacerbating risks rather than containing risks. Okay, and that's why we have law. We have law because it gives us process. Process is extremely important when there's an emergency. That's the whole point of a process. You use the process when there's an emergency. You don't say, oh yeah, if there was no emergency,